salmonella. The objectives of my thesis work was to determine the grids of non-typhoidal salmonella, Indians in cats, dogs, and in surrounding environment, screening of sample from Comau region of Uttarakhand, whole genome sequencing of salmonella isolates recovered from dog, cats, and its surrounding environment, generating vigilance gene repertoire, and their functions, and detecting antimicrobial resistance genes in the isolates. Then, study area that was taken into consideration was Comau region of Uttarakhand, and then directly I'll come to the results. I started this. So, sorry, just going. So, it's going forward, sorry. So, yes, bacterial isolation was done. First of all, pre-enrichment was done in BBW buffer peptone water. Enrichment was done in Rappaport vessel arrested. And the selective plating was done in xyloslicin telgitol 4. And out of 300 samples, 62 samples exhibited suspected salmonella colonies till gram staining. And in gram staining, we saw that there was reddish pink, it was gram. In XLT4, we saw reddish pink in color, blacks into colonies. And in MVIC test, we got minus plus was MVIC result. And out of this, 15 colonies exhibited displayed in alkaline red sand and acid yellow bud. That was positive for TSI and it was negative for UAS. Then molecular characterization was done. Among 56 isolate tested, only 40 of them produced 284 base pair amplicon specific to InVG and thus confirming the presence of salmonella genus. Then I outsourced my samples to National Salmonella Center at IVI, Izzat-Nagar, and then after serotyping, I got result that is a significant portion, that is 22 isolates out of 40 were Salmonella Kentucky, and another were 8 isolates were Salmonella infantis, and 3 was bird show, and 7 isolates were untypable. I got 100% success rate. This was the result in last 2 years for Salmonella and IVI. And then is coming to epidemiology. Then overall occurrence rate of Salmonella in dogs and cats was it was 10 were positive out of 87 sorry. In dogs and its surrounding environment, 30 were positive out of 230. Total 40 were positive out of 300. And sample-wise occurrence of Salmonella species recovered from dogs and cats in its surroundings. We saw that maximum occurrence rate was in feces, and after that, maximum was seen in the bedding. Then is in dogs in its surrounding, maximum again was seen in feces, and then next was in drinking water. This was serotype-wise sero-1 distribution. Again, the sero-wise occurrence of samples of Salmonella species in cats and its surrounding. This is the result. Location-wise, what I found that in Haldwani there was maximum prevalence in dogs and in cats and its surrounding, and in location-wise in dogs and its surrounding, maximum was in Rudrapur. Okay, then we'll come to directly we'll come to the whole genome sequencing analysis. I outsourced my sample to Biocard Private Limited in Bangalore. 10 samples I gave them due to economic point of view, and Illumina sequencing technology was adopted for whole genome sequencing. I got the raw data in the form of FastQ reads. Then after that, cut 4.4 command line interface was used for adaptive trimming. After that, after adaptive trimming, the FastQC was done. The de novo sequence assembly software called Spades were used to assemble the context. These are the small contexts, and then Ragnar was done for aligning and connecting these contexts from various assemblies to create a genome assembly that is more comprehensive and precise. After that, the fidelity of the assembled scaffolds was subsequently evaluated by comparing them to the corresponding reference genome we have to take. That was the number I'll give you. And the Quast 3.1 was used, software was used. Then Proca command line software tool was utilized for a rapid annotation. Then the serotyping of WGS data was done in galaxy.eu. of typhoemuria. And then virulence gene repertoire was generated, and VFTP database was used in galaxy.eu. And we've seen that for virulence, salmonella there are so many salmonella pathogenicity island, but most of our studies are salmonella pathogenicity island 1 and 2. So this is with VFTP finder database, we found these 105 plus virulence genes. This is T3SS1 types, and I'll show you. The others were these are T3SS2. Now antimicrobial resistant AMR profile was generated. And what we particularly, it was with NCBI Finder Plus, and then it was seen NRES Finder database also, which resulted in identification of 6 antimicrobial resistance genes, and these genes confer the resistance to 4 distinct groups of antimicrobial agents. These were aminoglycosides, trimethoprim, sulfonamides, and tetracycline. The conclusion, I have already spoken about this, and there is, we have seen that factors such as contaminated water sources, feed, litter, and equipment contribute to the presence of salmonella, and ineffective sanitation practices, inadequate segregation of hygienic and contaminated zones, and insufficient pest management further elevate the prevalence of salmonella in animals. Again, sporadic cases of salmonellosis may occur in general cat and dog populations, but outbreaks of the disease tend to occur in confined group of animals, particularly those in the kennels, research facilities, and veterinary hospitals. Animals in the confinement often experience environmental stresses, and there can be overcrowding also, and changes in diet, heating, lighting, and humidity. These are certain factors that can lead to more salmonellosis. And animals in research facilities may be exposed to stress during the shipping. I'll explain this again. What was one more thing? There was I used plasmid finder also, but there was I couldn't find any plasmid. It was not detected in my study, and then the future aspects of our study was this data can help to formulate the public health policies and preparedness for the control of this spread of the zoonotic non-typhoidal salmonellosis. And WGS can prove to be a perfect tool for outbreak investigation and conducting source attribution studies and determining genotypic markers of AMR and virulence. And sequencing data can be utilized to detect resistant determinants and provide information on the phylogenetic links between isolates and making it a quick alternative to tracking and changing AMR patterns. I did phylogenetic analysis also after this, but in my research work, I did this much work. And then as the older techniques were adopted, like the serotyping, it used to take a lot of time. So this is like an advancement that we can, it can be done within 1 or 2 days. The data can be processed, which would have taken someone around 1 or 2 months. So, thank you so much.
Dr. Eswan. So in the surgery folder, your name is there.
Yeah.
It is in thesis. You check the thesis folder. Go back. Go back.
Yeah, good afternoon everyone. Welcome to my thesis presentation. My thesis topic is modified dynamic screw plate with a lag screw for the therapeutic manner for the treatment of proximal femoral fractures in dogs. So coming to the objectives, we conducted the study to record the occurrence and to standardize the technique of usage using modified dynamic hip screw plate for the treatment of proximal femoral fractures, and to study the physiological, clinical, hematological, serum biochemical and biochemical parameters, and even we recorded clinical and radiological outcomes throughout the study period. So coming to the introduction, among the fractures, handling fracture shows the major percentage, and in that femoral fractures are more common. Even femoral fractures are classified again as femoral head fracture, neck fracture, trochanteric, subtrochanteric, diaphyseal, supracondyllary, condylar, and distal. So, in broadly, they were classified as proximal and short and distal femoral fractures. And again, proximal femoral fractures, it's classified as femoral head, neck, trochanteric, intertrochanteric, subtrochanteric fractures. So, the proximal femoral fractures are commonly seen in young dogs, that is almost less than 1 year of age. And major causes is falling from height or human violence or vehicular accident, and some rescued patients like unknown trauma. So according to Daly, the proximal femoral fractures are classified as intracapsular and extracapsular. The fractures within the joint capsule and fractures outside the joint capsule. The intracapsular fractures can includes epiphyseal, physeal, subcapital and transcervical, and extracapsular fractures includes basilar neck, intertrochanteric and subtrochanteric fracture. So coming to the technical program, the study was conducted for a period of 1 year, and the cases were screened for the handling lameness and further subjected for radiological and clinical examination. And among that, 6 cases were selected for the surgery. So the cases having neurological deficits and multiple fractures or open wounds were excluded for the study. So following surgery, the physical, clinical, hematobiological and radiographical examination was done before the surgery, after the surgery, and on 7th, 14th, 28th, 45th and 60th post-operative day. So coming to the treatment of this, the known treatment or earlier described treatment for the proximal femoral fractures, we have closed fixation and internal fixation. In closed fixation, like closed reduction and immobilization, like extracorporation methods, and closed pinning with K-wire or steam and veins. And in internal fixation, we have multiple K-wire or K-wire in combination with lag screw, or only solely with the lag screw, or totally replacement. Whereas in multiple fractures and more damage, we can go for excisional arthroplasty. So coming to the complications of these known treatment protocols, so it may go to pin migration, screw loosening, screw cutout, and refracture, malunion, and degenerative joint disease, and osteoporosis of the femoral neck, that reduced density of the femoral neck. So coming to the new technique or new concept, what you have to adopt for these kind of fractures is, so we have chosen dynamic hip screw plate. So this is the concept now commonly used in human medicine, the human surgery. So they are using specific plate, the DCB plate with the barrel with a specific neck angle that can accommodate the femoral neck fracture, the neck normal angle of inclination. So in human medicine it will come with 130 degree to 150 degree, whereas its barrel size, thickness and the plate size, plate thickness with width, it was more for the dog anatomy. So we have modified this according to our requirement. So usually they will use DHS screw first. After that they will insert the plate along with the barrel and the pre-inserted DHS screw. But we have modified that barrel. They have 12.5 mm width barrel. We have modified it into 7 and 8 mm barrel in width and length. They have 38 mm length width. It is more for the dog anatomy, dog femoral anatomy. And we have reduced it to 10 mm width 10 mm and 8 mm barrel, and plate size is 3 mm 3.5 mm. So apart from regular orthopedic instruments, we need to use some specific instruments for this technique, like cannulated drill bits, as we have to prefix the fracture with the K-wire and we have to proceed with the technique. So the pre-inserted K-wire should be there till end of the procedure. So we have to use all the instruments which are cannulated, like cannulated drill bits for the barrel, even cannulated drill bits for the lag screw, and even cannulated screwdrivers. Everything should be cannulated. So and for inserting the K-wire or the screw, it has to be inserted at a specific angle of inclination and antiversion. So in dog, the angle of inclination or the femoral neck angle varies from 142 degree to 147 degree. So we have used the fixed angle guide. You can see here, this is 145 degree fixed angle guide. Even we will get variable angle guide also. We can adjust the femoral neck angle or the angle of insertion of drill bits or the K-wires. And these are the implants used: 3 mm and 3.5 mm DHS plates, and the screws, partially threaded screws used as a lag screws, and 3.5 mm screws are used. Yeah, as I told, the selection of material: 3 mm, 3.5 mm plates are used of 10 mm width, and 4 hole, 6 hole plates are used according to the patient. And barrel size was 10 mm of 7 mm and 8 mm width, and 4 mm cannulated screws were used. That was pre-measured on the contralateral limb. So we have, apart from the whole cases, we have selected 6 cases of different fractures, like transcervical, subtrochanteric, capital facial, basic cervical, and 2 of intertrochanteric fractures. So on presentation, patient were examined thoroughly. Clinical examination, neurological examination, wound and hematological, serum biochemical examination, preoperative radiographical examination was done to assess the type of fracture and the patient condition. So the X-ray of the contralateral limb was also taken for the measurements of implants or the screw length what we need. So for the surgery, patients will be pre-medicated with regular atropine sulfate and xylazine as a pre-medication, and preoperative antibiotics was also given, and preemptive analgesia, meloxicam and tramadol was given, and anesthesia induction and maintenance was done with 2.5% thiazole at the dose rate of 12.5 mg per kg. So coming to the surgical site or the area of interest, it's the lateral thigh region. Craniolateral approach was used. So the lateral thigh region was shaved and thoroughly prepared for the aseptic surgery, and dog was positioned in a lateral recumbency, and keeping the affected side upwards. A cranial lateral incision was made. So incision will start from cranial to the greater trochanter, curvilinear incision, and which goes along the cranial border of the femur. It is the mid or distal aspect of the femur to accommodate the proper exposure of the femur and proper placement of the plate. So upon skin incision, the underlying subcutaneous was dissected, and to identify the tendinous junction between biceps femoris and the fascia lata, and cranially, proximally, tendinous junction between the superficial gluteus and the deep leaf of tensor fascia. Both are transected to dissect the underlying muscles. So upon dissecting superficial gluteus and tensor fascia, we will find middle gluteus and deep gluteus. The middle gluteus was retracted, and for the proper exposure of the hip joint and proper alignment and handling of the fracture site, the deep gluteus was transected. The partial tenotomy can be done. So here vastus lateralis and biceps femoris were retracted, cranial and caudally respectively, to expose the lateral aspect of the femur for proper placement of the plate. So this is the fixed angle guide, what I was talking about. So upon reduction of the fracture site, the fixed angle guide was placed. Usually the pin insertion site is caudally and distally to the greater trochanter at the level of third trochanter. So you have to follow the angle of inclination with the fixed angle guide, and you have to keep in mind that angle of antiversion, that is around 15 to 20 degree in dogs, that you have to keep in mind. And it is done under C-arm guided to facilitate the proper position of the pin, and we have to avoid the pin insertion to the hip joint. It may cause post-operatively, it may cause more complications like DJD and all. So we have to prevent that. So after inserting KY, so the KY has to be in place. We have to take out this fixed angle guide. Along with that KY, we have to drill for the placement of barrel. That is around 7 mm to 8 mm drill bit according to the plate size. It has to be driven for 1 cm, that is 10 mm for the length of barrel, to place that properly. After that, we have to place the DCS plate, and we have to drill for the placement of lag screw. That is for the 4 mm lag screw we have to place. So we are using 3.5 mm cannulated drill bit here. So it has to be driven along with the KY. So KY has to be in place for the temporary reduction of the fracture sites and fracture site. So lag screw was placed, the 4.5 mm screw was placed, and the DXS plate was fixed to the shaft using cortical screws, 3.5 mm cortical screws. So after placing the lag screw, we can remove the KY. So the plate was placed properly. So we have to go for post-operative radiograph to check the screw size. It should not pass through the hip joint, and proper position of repositioning, the reduction of the fracture site and proper placement of the implant. We have to go for the post-operative radiograph. I will show you in the next slide. So routine closure was done. The temporary tenotomy, what was done for the deep gluteus and middle gluteus separation, everything will be closed using observable suture material. And even tendons junction between biceps femoris and fascia has been closed, and subcutaneous suturing, skin suturing was done. Coming to the post-operative management, antibiotics were given for 7 days, and anti-inflammatories were given for 3 days. The carprofen and tramadol was given for 5 days, and the relaxant was given. In the alternative day dressing was done, as a lot of intervention is there and lot of surgical intervention is there to check the serum accumulation or the wound swelling, anything. So strictly for first 1 or 2 weeks, the strict cage confinement or minimum activity should be allowed. So to avoid the screw cutout or the refracture and all. So either we can go for slings and all. And sutures were removed after 10th post-operative day. And after 14 days, after 2 weeks, slowly we advise to start the physiotherapy, slow walks or short-leashed walks. And if you are noticing any, due to reduced range of motion for the first 2 weeks, we may notice some muscle atrophy or the total not weight bearing limping and all. So we can go for extension and flexion of the limb, mild physiotherapy and IR therapy we can use. And post-operatively, radiograph was done, and hematological serum biochemical examination was done, and weight bearing was recorded till 60th day. So coming to the result, as we recorded the occurrence, proximal femoral fractures were accounted for 22% of the femoral fractures, like remaining was the shaft fractures and distal fractures. In proximal femoral fractures, capital facial fractures were more common, that too in young ones, because of the feeble cartilage, the growth plate, and stronger attachment of the femoral head to the acetabulum. And higher incidence was seen in males and less than 1 year of age because of high activity. And we have measured the post-operatively the physiological parameters and hematological parameters There is no significant changes were noticed, and all values were within the normal range. Coming to the serum alkaline phosphatase, we have noticed some significant increase in the initial days of the surgery, that immediately after the surgery, and peak level was noticed around 28th day because of the osteogenic cells and osteophytes involved in the bone healing, and because of the osteoblastic activity. And we have noticed a drop in serum calcium, as calcium from the serum was drawn for the initial deposition at the fracture site. And initial increase in the phosphorus was noticed because of the more alkaline phosphatase activity, and more increase in the inorganic phosphate at the fracture site. And at 60th day, the patients have shown excellent healing, the weight bearing, even the radiographically evident fracture healing. So the plate what we have used along with the barrel, it has given additional support to the implant for the lag screw. It has helped in maintaining normal neck shaft angle of the femur, and it has given rigid stability and in weight transfer also. So in our cases there is no, except one case, remaining cases satisfactory, like no complications were noticed. As one case was we have selected was capital facial. There is a very small bone fragment, bone purchase for the placement of lag screw. So this technique may not be indicated for the capital facial fractures. So remaining all other fractures like neck fracture, trochanteric, subtrochanteric, intertrochanteric fractures, it's a good procedure technique. So preoperatively we recorded the patient condition. So this is the intertrochanteric fracture. As the fracture line goes through the trochanter, so PET immediately after the surgery. Like radiographic examination after the surgery to check the screw placement, the proper placement of the implant and all. So patient on 45th day, and radiographic examination on 45th day. Here you can notice the callus. There is no visible fracture line, and there is no extra deposition of the callus. There is a minimum callus. This is on 60th day. The other patient, so in conclusion, what the plate we have used modified DHS along with the lag screw for the proximal femoral fractures. It has given a satisfactory results among the patients or study what we conducted, and technique has provided the proper anatomical reduction and intrafragmentary compression through the lag screw, and it has maintained the normal angle of inclination, and it has given additional support to the compared to other implants. And the care was taken during the surgery to not damage the articular surface of the hip. And as I told, the technique was found inappropriate for the facial fractures, as there is a minimum bone purchase for the lag screw placement. Thank you.
Okay.
Now we came to conclusion for this session. Now I would like to apologize again. I'm repeatedly asking him for this. Now again, once again, request apologize to come on to the rise so that our chairman and the rapporteur will be felicitated. I request you, sir, to come on to the rise. I request Rao, sir, also come on to the rise so that you will be. Request now repeated to come on to rest to take his this. That's all from the session. Now, thereafter, the next session that will be separately announced. Thank you.